The time you go to wake up in the morning till the time you go to bed. It's not a joke. Like, you don't care what you do. I've stole from stores. I've stole from my grandmother, my mother, my children, my neighbors. I didn't care. I just wanted to feel that rush, that goodness, that high. And I didn't care how I had to do it, break the law or not. I had to. I had to have it. It was my life.
So Katie has kind of put herself out here and shared significantly. And I'd rather than have we continue to ask personal questions of Katie that might be more personal in nature, I'd rather ask Katie to step down and say thank you very much for doing that. I know you're awful nervous.
Can I ask her one question before she steps down?
And then we can answer some questions for you.
Just Katie, is there any one thing that you would give us as advice to help the kids that are suffering from this sickness? Is there anything that you can think of that would be most important to help?
Just try your best to stand by them. Don't give up on them. As soon as you give up, then they have nothing. We have nothing, you know. Support them and try to explain to them, try to get them to get help, you know, because you can want help. My mom wanted help for me for 15 years until I was ready. But she stood by me. She never gave up on me. So,
Katie, thank you for sharing today.
So, Jim, along with Katie's story, okay, so she is a success story right now as far as staying with the treatment and everything. We have so many, and I was a correction officer at our county jail, so it's a revolving door. The same people come in and out. So how do we go about convincing these people that they need help? Because, like Katie said, you have to make the conscious choice to choose. You made the choice. We make our choices every day, no matter in what part of our life it is. So we make a choice to drink alcohol, to get drunk, or we make a choice to take the drugs and get high and keep doing it. So how do we convince these people? What is it that we need to do, or how do we go about convincing these people that need help? She got to stay in jail. Is there something that we need to advocate through the state justice system where they can be forced to go to these programs? I mean, right now you have drug court, you have the Willard program, the state prison system, but I've seen numerous people go into them programs. As soon as they get out, they hang out with the same crowd again. If you don't change your lifestyle, it's never going to work.
Correct. And there's no easy solution. It's different for everybody, but that's why I think it's important to look at law enforcement is crucial. And for some, it's holding people accountable. And whether that's that stay in jail, or we're going to say that you need to do outpatient treatment, or maybe you need to do an inpatient or a residential treatment program. And we can't give up on individuals. This is an addiction that is affecting all socioeconomic classes, and it's impacting our youth. It's people who have had an injury in sports that are becoming addicted. It's your neighbors, it's family, it's people we know. And we can't give up on them. And it's going to take the support of their family to get them through that, the support of the community, teachers, probation officers, any role models that we can think of to try to play a positive role in getting that person on the right track. And even when everything is set up, there's no guarantee that this is going to work for them. And it's different for each person when they get to that point where they're ready to say enough is enough. And we just got to keep working with them and offer different treatment options to try to help them on the right path.
You know, Jim, what you just said, like in the paper Sunday, it listed the court report from Friday, and 3/4 of the court report were drug issues, and it was all ages and all genders. It was, I mean, they were from 20 to 57, you know, and I would imagine it's difficult. You got to take everybody as an individual and just give it all you got.
And give everybody that opportunity for treatment. And because you never know whether it's the third treatment episode or it's the fifth treatment episode that something clicks with them. And we're hoping offering medication-assisted treatment is a different option that has not been available. There was nothing between Syracuse and Plattsburgh or going Utica direction. So we have some other options now available that we can try, and we just got to continue to fight the battle. And this is the hardest substance I've ever seen for individuals to try to get away from.
Sounds like it. Andrea, you like the center of attention, so I want to ask you a question. What you said that they come in for assessments. Is that by force? Do they have, like, is the court telling them to come to you for an assessment when they come up, or?
Sometimes they're mandated.
Yeah.
They can be mandated by court. They can be told to do so by DSS if they're trying to receive services. But ultimately, it's still up to them whether or not they want to engage in treatment.
That was my next question.
Sure.
Do you do half of them engage in treatment, or what is the success rate of you getting someone into treatment? And I don't mean that to be critical of your program, but I mean it's up to people.
Sure. Typically, if a client comes in and they are mandated, they will come into treatment not happily, normally at first, but a lot of times, and it will happen with a lot of individuals that come into treatment who don't feel like they're going to get anything out of being in treatment. They will come into a group session or an individual session. Sometimes it only takes you hearing something one time from one person for something to click. Yeah. And you get something that you never expected you were going to get.
Is there a financial issue with this? Like, if somebody comes to you for an assessment and declines treatment, is it because they can't afford it, or is your treatment typically open and free, or how does that happen?
Well, if they have insurance, they will provide their insurance card. Okay. We offer a sliding scale for payment.
You do what you can to make it affordable for them.
Absolutely.
I just want to question, what if they can't afford it and they don't have insurance? Is there a free program, or?
The sliding fee scale is pretty reasonable. We try to keep that so that the cost of treatment would not be a barrier. So we really try to work with that.
I do think, though, that there's a need for insurance companies to relook at this problem, because having experienced it personally, when they go into treatment, they go to Albany, in 2 weeks they're out the door. And in many cases, and in my experience, they know they're not ready to be out the door, but the insurance companies cut them off. And they would stay otherwise, and maybe be successful in the treatment. So we've got some real issues with the cost of solving this problem.
Absolutely. Absolutely, that's the case. And as we approach a managed care environment, we're likely to see length of stay reduced rather than being able to extend that. And our field has been advocating that there's some individuals you need a full continuum of care with outpatient, with more intensive outpatient, with an inpatient program, and residential, so that you have a full continuum to offer individuals.
Andrew described a process of dealing with a whole person, helping them with resumes and that type of thing. It seems like that's what we need to do, is develop a whole program with all our various agencies working together to help to try to overcome this.
And I'll say that Pat Freilich, as the Community Service Board Director, has been tasking us with just that, with how do we work together with providers so that we're all working together to meet the needs. And there's a lot of good meetings that are where good people are coming together here in Lewis County to try to resolve this. And this has been an awful issue. And I know the number of deaths here in Lewis County. It's impacted families. It's impacted individuals that you know. It's impacted your neighbor. And it makes my stomach sick every time I read it in the paper or hear about an overdose. We just got to continue to fight this battle and work together to try to help every individual.
You say she tasked you. You got to see what she does to us. There you go.
Thank you. Pat, where do we go from here? You're going to continue to keep us informed?
Correct. Really, initially, our focus is going to be community education, making sure that we're not creating our own barriers to people getting into the services that they need, and that people are aware of the services available locally. So that's kind of where we're going to start, and then I will report to the Board of Legislators periodically over the course of the year.
Very good, because I'm sure we'd like to be involved and do what we can to help on our part. So, thank you.
If you can remember one thing that I think Katie said it and Dr. Paisanello said it, that talked about that addiction is a treatable medical condition. And much like any other addiction, if somebody has a mental health problem and they need to take a medication to address their depression or anxiety, then they should be entitled to get that medication. If somebody is diabetic, then they should get their insulin. The same thing is true if somebody suffers from an addiction and they need medication to help them to be able to function and get back in society, then by all means, give it to them. And let's be supportive of that. And my reference is, if it were one of my children that were impacted, would I want my child to go to an opioid treatment program or any treatment program for that matter? And the answer is yes. Because the alternative with this epidemic is that they're going to seek out those drugs on the street. And I'd rather have them get them under the supervision of a doctor and clinical and medical staff as opposed to getting those opiates or heroin off the street that you just don't know what's in there and putting them at very high risk for overdose.
Question behind you.
I was just wondering, where does our county stand on like getting a methadone clinic here? Or if the boxing clinic, I mean, I know we have Cradle, but we don't have a place that dispenses methadone or boxes for people that can't make it.
I know the state positioned and looked at where to place these different clinics, and they're opening them up in Syracuse, Rochester, Troy, New York, Albany, Buffalo, and they looked at Watertown as being kind of the central for Jefferson, Lewis, and St. Lawrence. We're not likely to get one to come to Lewis County. What we can do is, Dr. Paisanello is doing some strips for individuals for the Suboxone in Lewis County, and what we can start looking at is if there's a need for transportation to get individuals from Lewis County to Jefferson County so they can participate in that opioid treatment program, then we need to make that happen, and we will work on that.
Jim, if I could ask, why is the state reluctant to expand facilities where you can get them?
Yeah. When we started this, the waiting list for Crouse Hospital was 6 months and 500 people. As a result of new clinics that have been opened throughout the state, they're now down to 100 people on the waiting list and about a 3 to 4 week wait. So they're opening these up strategically, but we won't be able to see them in every county. There's a lot of regulatory requirements that need to be met to open an opioid treatment program, and to be honest with you, there's difficulty in staffing those. The medical and clinical staff that you need are a real challenge. You have to have a physician, and you have to have full-time nurses. So I don't think we'll see them in every county, but they're looking at this regional concept and Jefferson is kind of where they planted the one for the North Country.
Okay, so it's certainly been an enlightening session.
It really has.
We really appreciate you and every one of you for coming here. Thank you. Legislator need a break?
Yeah.